Afternoon, DEC members, members of the media, and a special hello to Schoolcraft College and Dearborn Divine Child High School students who were invited to participate. My name is Steve Grigorian, President and CEO of the Detroit Economic Club. I certainly hope everyone is healthy, and we look forward to getting back together in person when safe to do so. So for today's meeting, you're all muted, but we want you to submit questions via the Zoom chat room, and we'll get to those as part of our conversation. So let's get started. Our guest today was scheduled, as most of you know, to visit the DEC on March 24th, but for obvious reasons, we had to postpone. And we're hopeful he'll visit us in person later this year when safe to do so. We are so pleased to host Dr. Tom Mihaljevic, President and CEO of Cleveland Clinic. He operates a $10 billion powerhouse medical system. They were recently ranked by Newsweek magazine as the #2 hospital in the world. So Tom, welcome. We appreciate your time during this pandemic, and I want to say thank you to you and your enormous team of heroes on the front line.
Yeah, Steve, thank you very much for having me. I'm absolutely delighted to be here on this program and look forward to meeting your audience in person in the future.
That's very kind, thank you. Well, we've got you for about 28 more minutes, so let's get started. And I'm gonna ask you first just to start broadly by telling us a little bit about the Cleveland Clinic.
Yeah, Cleveland Clinic is a large integrated healthcare delivery system. We provide services in more than 200 sites that are spread not only here in the United States, but also internationally. Our biggest presence is obviously in our home state of Ohio. We're based in Cleveland. We're just about to celebrate our first 100 years next year. We also do have a very strong presence in Florida, along the southeast coast of Florida, and a presence in Las Vegas in Nevada. Internationally, Cleveland Clinic is present in Canada, in Toronto. We have a very large hospital in Abu Dhabi, United Arab Emirates. Cleveland Clinic Abu Dhabi has been in function for the last 4.5, 5 years. And we're soon to open hospitals in London, England, as well in Shanghai, in China. We employ close to 70,000 caregivers across the world.
That's amazing. So I guess let's start talking about certainly what's on everybody's mind, and that's COVID-19. So you've got all these locations. Talk to us about how you've had to respond to the COVID-19 crisis, given all the different locations you have.
One big advantage of large international system like ours is that we're completely integrated. What that means is that we really operate every facility in every part of the world or the United States in a similar way, and we're always connected. We meet every week, the executive leadership of each Cleveland Clinic location. So when it comes to this COVID pandemic, that has served us really well, because we have learned about some aspects of the pandemic earlier than other of our colleagues here in the United States, because our Cleveland Clinic in Abu Dhabi started taking care of COVID patients before the cases were observed in the United States. And that raised our alertness here in the United States, and we started preparing for the COVID pandemic in January. And that put us really in a good position to make sure that we have the equipment for our caregivers to provide care, that we can also build an additional capacity in anticipation of the wave of patients who will be affected with the pandemic. And that international footprint has yet again demonstrated itself as a big advantage.
That's a huge advantage. So I know it's been a massive effort by all of you, but how have you prepared yourselves for the COVID-19 patients?
Well, we used the best possible information that we could from all responsible sources and reliable sources internationally, in particular from the countries that experienced the pandemic in the earliest stages. We have a very good working relationship with a huge network of healthcare professionals throughout the world. Cleveland Clinic has educated so many, and we have a lot of alumni in every every country in the world. So we were closely connected with our colleagues in Italy, for example, in Milan, and learned a lot about the best practices for the management of COVID patients. We adopted very many of those practices here in the United States as a part of our preparation. And yet again, our learnings from Abu Dhabi were extremely valuable, as well as our learnings from London. We have a team in London that is building Cleveland Clinic in London. Although we are not open yet, will be soon. We are fully integrated in healthcare delivery in the United Kingdom. And those are just simply valuable lessons for us.
I know you were at the White House recently as part of the ventilator loan program, and you were part of the briefings. Were you able to learn something from all of the international contacts you just spoke about that had the pandemic a little more robust than we did earlier?
Well, we had 2 visits. I personally visited the White House twice over the last couple of months as a member of a delegation of CEOs and presidents of a larger healthcare organizations here in the United States. And we visited it for the first time in February and then relatively recently. And I have to say that we have faced a very collaborative atmosphere. The federal officials have asked us for our suggestions. And they have really acted on our suggestions almost immediately after we presented it to them. I'll just give an example of 2 that were very, very important. One suggestion that has really transformed the way that we deliver care today in the United States relates to the use of telemedicine and digital platforms. Before the COVID pandemic, because of the individual state regulations, hospitals or practitioners from one state could not provide telemedicine services in other states unless they were to have a license from that state, which makes the use of digital technology on a large footprint impossible. Can you imagine obtaining 50 different licenses for a single practitioner so that we can serve the population in the United States? That restriction was lifted by the federal government, and it really has enabled us to touch many more lives in the United States and help many more patients by simply not be burdened by bureaucracy. The other good example is loosening of the FDA regulations that pertain to the in-house testing for COVID. And FDA, for the first time, has really allowed individual hospitals, large hospital systems like ours, to develop and apply in-house developed testing for COVID patients. And that has really allowed us to raise the bar when it comes to the quality of care that we provide.
Locally, I can't thank you enough. Most of us have heard the stories that Cleveland Clinic reached out to Henry Ford Hospital and New York Presbyterian Hospital because of the hotspots that we're in. So thank you for doing that. And can you tell us about that effort?
Well, here in Ohio, we were fortunate because we were one of the first states that had implemented the regulations that pertain to social distancing. And because of our central location within the United States, we were not really exposed to the big wave of COVID patients, although we were fully prepared to do so. And as we were here being fully prepared to meet the large demand of COVID patients in the state of Ohio, we simply did not experience that wave. So yet we had a lot of resources, caregivers, personal protective equipment that was available to us. So we simply could not watch our colleagues and our patients in a neighboring state struggle. And this was just the right thing to do, simply, Steve. There was, I called my colleagues at Henry Ford and offered help, which they graciously accepted. We did the same thing for the New York Presbyterian, and as a result, we have sent the groups of nurses and physicians, intensive care unit nurses and intensive care unit physicians, much needed relief to our colleagues in both locations. and they're still there. They're still being deployed. They're now about 3 or 4 weeks into it. They were warmly welcomed in their new environments, and they're already making a difference. I just spoke with them over the Zoom call today, and it was just a wonderful experience for them. And I hope that we're helping and contributing in the areas in need.
That's such an unselfish act by those individuals, and I saw some photos that there was a terrific send-off parade as the nurses were headed from your facility to Detroit, and I saw that you participated in that as well. So thank you for doing that. I want to switch our focus a bit and talk about the near future. Let's talk about your thoughts on opening the economy and why, in your opinion, is it important for us to do so?
Well, the opening, there's absolutely no doubt that we have to open the economy, but we have to do it in a way that is obviously responsible and in a way that takes into account a new set of circumstances. The reason to open the economy is obvious, yet the ways how to open it and the when to open it is a matter of debate. I would say in the United States, the timing of the opening economy has to be linked to the preparedness of the state of a community to meet the healthcare demands of that community. With this COVID pandemic, I think there are three things that had to be done and put in place before the economy were to be open in any region. One, first condition would be that the pandemic is under control, meaning that the curve is flattened. The second thing that we have to make sure is that there is a surge capacity that could accommodate the potential flare-ups of the pandemic. And the third condition is simply to have enough testing capacity. Here in the state of Ohio, we're fortunate to have fulfilled all of those three conditions, and we're now gradually opening our economy in the state. Opening of the economy, not just question of a financial viability, it is also primarily a question of health. What I would like to offer is the opinion that the matter of the public debate here shouldn't be about the money versus lives. One has to understand that the deep economic downturn carries a cost of human lives as well. The deferment of care that we are seeing currently in very many centers, we're seeing carries a risk that is difficult to quantify, yet it is very real. I'll give you one example. We are seeing 40% decline in the number of newly diagnosed cancer cases at a Cleveland clinic, and that is national trend. We're seeing similar decline in the number of stroke patients and the number of patients who are treating for acute heart condition. Cancer, stroke, and heart conditions are three leading causes of death in the United States. 40% decline translates in tens of thousands of potential deaths that could be preventable if the healthcare were to be available to all. So we have to find a way to open a healthcare safely, but also open the economy. The reason why it's important to open the economy is because the stability of the economy allows us to have a stable healthcare and to provide the care for all people who are in the need of our services.
Well, I know it's a tough subject, but you're also ranked very highly on one of the most ethical companies. So I know you've put a lot of thought into that topic. So as a healthcare thought leader, can you talk about maybe any long-term impacts you see from COVID-19 on the healthcare industry itself? I know there were a lot of hospital systems that were struggling financially even pre-COVID-19. What do you think about some long-term impacts?
You know, healthcare after COVID will look nothing like a healthcare before COVID. And I believe that even if you take a look at our economy as a whole, I think we're entering in a completely new and different world. And I don't think that we'll, in the near or midterm future, we will definitely not be resorted back to what we used to consider as a norm. In healthcare, there are probably 3 or 4 large trends that we need to highlight that will be transformational for healthcare. And by the way, I think they are all good trends. I think that our healthcare is in a paradoxical way will be greatly improved after this pandemic if we do it in the right way. The first trend when it comes to the patient care relates to the greater use of digital technologies to deliver healthcare. That has obviously now been picked up during this pandemic. This trend is not going to go away. The second big trend is going to be an even greater provision of healthcare at home, away from the hospitals, in particular for the vulnerable populations, so that we can meet the demands of our patients when it's convenient in the environment that is convenient for them. The second big trend pertains to our caregivers and our healthcare professionals. I believe that the society as a whole has recognized the importance that the healthcare professionals have for the entire society. And I think that the healthcare professional will regain the respect and the status that they have been gradually losing over the past several decades. When it comes to the third trend, that is the one that pertains to the hospitals and actually healthcare delivery systems. I believe that the large integrated healthcare delivery systems will come out of this crisis being even larger, because I believe that the integrated healthcare delivery system are the optimal vehicles for delivery of contemporary healthcare in 21st century, the healthcare that is based on the use of information technology and analytics. And I think subsequently that the smaller standalone practices, private practices, or smaller standalone hospital systems will suffer, or will be absorbed by the larger systems. And lastly, when it comes to our impact to the community and healthcare of the larger populations, I think we are seeing how important it is to address not just the need of an individual, but the need of the entire population. We cannot effectively protect an individual unless the health of an entire population is there. So therefore, broader access to the healthcare services will become mandatory.
I was going to ask you about a shift to wellness, more focus on wellness. And in my opinion, societal changes come from major events. Is the COVID-19 pandemic a major enough event where it may shift us into more of a wellness mode?
Oh, absolutely. It will have to. Because if we take a look at the most vulnerable population today that is affected by COVID pandemic or any major pandemic, that's the population that has what we call chronic illnesses. And those chronic illnesses such as diabetes, hypertension, and obesity are all related to the wellness or absence of wellness. So the best way to protect your own health is to make an investment into the wellness up front, and not only at the individual level, but also at a collective level. And I believe that we're going to have much more deserved attention being paid to wellness.
Well, thank you. We've got a few minutes left, and I promised the audience we would present some of their questions. So some of them came in via email in the last 24 hours, and then we've had a couple that just came in the chat room. Somebody asked about, are you seeing concerns from people that might need to be treated? Are they concerned about going to the hospital during this time? And what would you say to those people?
We are seeing that trend, and that trend is very clear. I mentioned it before. We are seeing about 40% decline in the services for chronic and life-threatening conditions, just because people are simply afraid to come into the hospitals. A really important message to all of them is that hospitals are safe environments. People should seek care and should not be afraid to seek in medical care. It is really important to make sure that their screenings in particular are being continued, that the management of chronic conditions such as diabetes and hypertension doesn't get neglected. I will give you an illustration how safe hospital environment are, but our own example here at the Cleveland Clinic. We have over 60,000 employees in the United States. We're currently having only one of our employees who is being hospitalized for COVID infection. So it's absolutely safe. We put a lot of effort into keeping this environment safe. And yes, please seek healthcare when it's needed.
Question about your crystal ball. Somebody wanted to know what your thoughts are. What does this fall look like, timing-wise, with regard to COVID-19? If we have a second wave, could it be bad enough to cause businesses to shut down again temporarily?
There is no reason for COVID pandemic to end unless we get to the level of a herd immunity, meaning unless we get to the point where so many of us get infected or exposed to the virus that the virus stops spreading, or unless that immunity is obtained through vaccine. In the absence of those two conditions, the pandemic is something, or presence of COVID-19 is something that we have to learn how to live with. And therefore, we will be most likely seeing the variations in an intensity of pandemic in different locations over the course of probably in the next year or two, as we hope that we'll be able to develop and administer vaccine, let's say in a year and a half or 2 years' time, which is kind of what most of us believe is a realistic expectations. In the meantime, we're going to see the flare-ups, but we're going to be smart and be able and much more able to identify them and contain them. But there is, once again, there's no reason for COVID-19 to disappear from our lives. So we'll have to learn how to deal with it.
Do you have any thoughts on the term herd immunity?
Yeah, the term herd immunity essentially says that the disease has been spread so far through the population that there is more than 60 to 70% of people who have developed an immunity, and therefore the virus cannot continue to spread from one to another because there is no place, there are going to be too few hosts for the virus so that the disease gets contained. We're far from it. We're at the very early stages of this pandemic, although it doesn't feel like that. You know, we've been only exposed to this new phenomenon, new illness here in the United States for the past 3.5, 4 months. You know, the first case in the United States was detected on January 21st.
One of our members is asking you to comment on if we think the focus going forward might be to isolate the elderly, as we know they are impacted quite a bit by COVID-19, so that the younger population can go on to live a somewhat normal life. Isolating the elderly, does that, yeah.
Yeah, well, I think what we did at the very beginning of this pandemic is what we needed to do. We essentially kept everyone at home as we tried to contain a disease and tried to learn more about the disease in the process. We essentially used the epidemiologic tools from 14th century to combat the first large pandemic of the 21st century. So we have yet to use any tools of modern era, such as medical advancements, digital technology, artificial intelligence, to combat this particular pandemic. But we're learning how to use those tools. The research has been more collaborative than ever. We're learning about this disease at a greater pace than we've ever accumulated information about any disease in the history of mankind. And we're developing the tools that they're going to allow us to have a much more discriminative tools and methods to combat this disease. Artificial intelligence, machine learning are now being put in a function of having these tailored methods when we will be able to understand who is at risk, where do we have to focus our limited resources in the most effective way, how can we trace and track people who were exposed to the virus so that we can minimize the ability of virus to spread elsewhere. And then lastly, obviously, we have a very active research efforts in areas of vaccination and other antiviral treatments for COVID-19. So I am optimistic. I believe that this is, once we use all of our tools and all of our knowledge, we'll be much more effective in containing the disease.
Somebody asked about collaboration efforts, Cleveland Clinic collaborating with other hospitals, universities, research institutes, other for-profit pharmaceutical companies in developing vaccines or treatments. Can you talk about that?
Yeah, we have currently a few dozen trials going on every aspect of the treatment of the disease, from the medications that would work as an effective way of treating the viral infection, to the vaccine itself, and to all adjunctive measures to treat the COVID pandemic. And I can say that in our academic community, in our medical community, we are seeing an unprecedented level of collaboration and an unprecedented pace through which the new knowledge is being generated. The communication and collaboration, even not only between the academic institutions, but between the private and public institutions and governments, and exchange information across the world, is remarkable. And I certainly hope that this trend will continue to go indefinitely, because it is going to help us advance the treatment for future issues that will inevitably come.
Chat room question, does this pandemic suggest to you the need for the U.S. to strategically invest in certain capacity? For example, do we need to make our own PPEs rather than relying on foreign suppliers?
Well, we'll have to do that. And every country will have to have a strategic allocation of resources within a country to be sure that when it comes to this global disruption of supply chain, that the vital provisions in a country, such as healthcare, is not being put in question. You know, the country like the United States should not be held hostage to our relative inability to produce something as simple as a gown or a mask. We know that we know how to do it. I have every confidence that we'll be able to. We know that we have resources that we can allocate to it, and I think every large country will do the same as we will.
Thank you. Concerned parent asking you, do you have any thoughts on what school would look like for their kids in the fall?
Well, my kids are asking me the same question, and I wish I could give you the right answer. We're getting letters and information from all the different schools that our children attend, and the answer is I really do not know. It will look different. I believe that just like telemedicine, the telelearning, as all of us who are parents and have kids in a school age have realized that, yeah, that's an option, and that's an opportunity. And I think probably by the fall, I would be hopeful that we're probably going to see some hybrid approach, maybe fewer classes, maybe less densely populated classes, and a lot of learning from home.
Final question for you, Tom, and it's a fun one, I hope. Earlier this week, the Air Force did a flyover over Cleveland Clinic facilities in Ohio. How was that received? What was the reaction of all of your heroes?
Well, there was a wonderful reaction. Obviously, our caregivers are just an inspirational, large family of people. We have a simple motto here at the Cleveland Clinic when it comes to our profession and our calling, is to treat our patients and each other as a family and treat our organization as a home. So when we see that this ethos that is so dear to our hearts resonates to a greater community and gets a recognition, including our Air Force, and with such a visible and wonderful recognition, it's really inspirational. So we're very grateful, very appreciative, and honored to be in a position to make a difference in people's lives.
Well, it was well deserved. And with that, we're approaching the end of our time with you. I want to say, again, thank you for your leadership. Thank you to all of, to you and your healthcare heroes for all that you're doing, and certainly hope that we'll be able to have a visit from you in person when it's safe to do so. So thank you again, Tom, for your time. We appreciate you.
Thank you very much, Steve. Thank you very much for having me.